Laura, my sister-in-law, and I decided to set up Memory Matters because we knew that people who were living with dementia were being diagnosed with the condition and then told to get home with nothing. And that doesn't happen in any other disease area. If you're diagnosed with something, you always get a treatment plan, but with dementia, you don't. And we realised that this was wrong. There are plenty of things that you can do, so we set up Memory Matters to enable people to thrive. And we started that in 2010, and it started with Laura and I going to people's homes and spending 2 hours with them, doing some really exciting, fun activities with them while their carers went off and got their hair cut. And that's literally how it started. Until those people started to say, we'd like a little bit longer, and a little bit longer, and actually it'd be nice if he was with other people. So we started our groups out in the community, in community centres, and ran something called cognitive stimulation therapy, which is a talking therapy for those with dementia. And it's a good laugh, and you get to eat a lot of cake, which is why I'm not a size 8. And you just engage them in fun, stimulating activities, which is enjoyable. And that tied in for me, because there was one thing for me that I really struggled with as I was doing all my nurse training and when we started Memory Matters was I hated seeing people struggle. It was one of those things that really gut-wrenched me. It always made me really upset. I didn't like to see it. And actually my raison d'etre is actually nobody needs to struggle, so why don't we make that life a little bit easier? So Memory Matters were running out in the community quite happily for quite a long time, until it's Gareth's fault. And I'm going to blame Gareth because he's in the room, and I always blame Gareth when I tell this story, but we sat around for quite a while about the next stage for Memory Matters and thinking about how we do it. And Gareth came up with this lovely idea. It wasn't me, I'm not going to take credit for it, it was absolutely his fault. He said, why don't we open a cafe or something? And the idea about a cafe was really interesting. I was nurses, we had no idea about cafes, literally. Gareth. Gareth's a non-exec director on our board, so interestingly those conversations were fun to have to begin with. We did a whole feasibility study about is that something that we'd do, and the idea was born from people living with dementia needing to access advice and support on the spot. They couldn't get to see a GP. GPs didn't really know what was available in the community, and we did. So we felt like we held a lot of information that we could share to make people's lives a little bit easier. And we looked at a variety of little spaces. Initially we thought, let's get a tiny little place with a couple of little tables, and we'll have somebody that sits at a table that can give advice out. That was the plan. As you can see, the plan grew somewhat, and I think it took us, we did a big feasibility study that looked at whether doing something on a larger scale would work, and 6 years ago we decided to take the plunge, and we walked into this building, which was derelict at the time. Actually it wasn't, it was a charity shop at the time, so there was floor-to-ceiling junk everywhere, and very tatty and very cold and not a very nice place at all. And decided to sign a 10-year lease and just go for it. What that did for us was it gave Memory Matters a face. We'd been fairly faceless for quite a long time. Working in community centres out in the middle of nowhere, people didn't really know who we were and what we did, and as soon as you open something on the high street in the middle of Plymouth city centre, people go, okay, that's what you do. So the idea behind this place is very much a social enterprise model. So the cafe is open to the public, anybody can come in, anybody can hire the rooms, and what we do with that is we generate surplus to enable us to run that free dementia advice and support for people when they need it, linking into all the other social enterprises, linking into statutory services, and making sure that journey for them is the easiest journey that they can have. So we do an awful lot of work. I think in the last year, we've seen over 350 families and supported them through the diagnosis or not diagnosis, as the case may be at the moment, and thinking about what support they need, not based on their disease specifically, but actually what's the symptom that they're struggling with that we can help with. And so far, 5 years down the line, we're still doing it. So it was really important when we first started, this place especially, but all the way through, that we recruited people based on their values. So we made sure that we had people who thought the same as us, who had the same needs, that understood what it felt like when you see somebody struggle, that understood how You can make somebody's day just by asking them if they're okay, by recognising when people might be having a difficult day, those kind of things. And that's the stuff that you can't really teach. That's the innate stuff inside you that I can teach somebody how to make a coffee on the coffee machine. Well, I can't, because I can't make coffee down there, but you can teach somebody those skills. You can teach somebody how to take an order on the till. You can teach somebody how to work out how much money it takes here, there and everywhere, but I can't teach people to be kind. So we recruit quite often on values. That's how we start, is working out what their values are. And I think that goes back to my nursing in terms of making sure that the people that you worked with on the ward were there to care for people, and it's the care bit that was really important, and that sort of transposed itself into Memory Matters. And we use something called values cards. I've got some with me, I'll bring them in later, but they're quite good fun to do, and actually we give them out to the team, and it's like, go and do your values cards, and they come up with these 6 values and they stick them on the wall in front of them, and what it does is it highlights where their strengths are and also where their challenges are. So actually we'll know that, for instance, Vanessa, who sits in our office, who does all our finance, absolutely loves data. She's data whiz. There's nothing gives her more joy than looking at a whole spreadsheet of boxes and working out what it means, as opposed to Emma, who you ask her to look at a spreadsheet and she'll vomit. So, and knowing where those skills are really, really helpful. So it doesn't matter what your job is, you always know somebody in that organisation, but that innate value underneath is always the same throughout all of us. So we built on that, thinking about our team, especially during the pandemic. That was something that we started to think more and more about, is how do our teams and the people that we work with really feel, and how do they feel when they're here, and can we make sure that we know when they're feeling difficult that's addressed. So wellbeing at work became really important, and we had a member of staff downstairs who became trained in, well, actually about 4 or 5 of them became trained in mental health first aid. And it was a real driver for them to make sure that everybody felt happy and well at work. So everybody now has their wellness action plan, and their wellness action plan is really interesting because it makes all the staff really think about what makes a good day for them, but also what makes a bad day. So some of the questions have on there are, what helps your well-being to stay healthy at work? Are there situations at work that might trigger poor mental health for you? How do you normally manage stress? What steps can you take? And then the key ones there are, what are those early warning signs for you that make us know that you're having a tough day without you telling us you're having a tough day? Because everybody has tough days, but you don't often talk about it. What can we put in place to help minimise those triggers for those bad days? But also, when you understand that you're having a bad day, how do you communicate that out? And what is it that you need to make sure that that turns into a better day? And having those plans has been really interesting, because what we've done is they've filled them in, their line manager's been aware of it, but they've been allowed to share that with whoever they want to share it with. So if there are people that they normally work a shift with, what they said is, actually, can you have a little look at my wellness plan? So that you know that if I'm having a really crappy day, how can I do that a bit differently? And what do you need from me? So it's been really helpful, but it also means that they can bring their authentic selves to work, and also share that actually showing your vulnerability isn't a bad thing, because we all have it, and not to be afraid of that. But also, when you bring your vulnerable self up to work, you kind of open yourself up a little bit to some negative and ill-being. So it can go both ways, but they know that and they're all aware of that. So it's interesting to do. Thinking about having people here on work experience, the team absolutely love it when we have work experience people here, for 2 really good reasons. Firstly, having new people around, they ask loads of questions of them. Very much like, what do you think of that? Do you think we could do that any differently? If you or your mates were walking in, what would you like to see? You know, what is it that's, especially on the menu, what's on the menu that you would really eat? And if you're going to go somewhere else, what would you order? So we can do all sorts of things, and actually learning from them is the most important thing. That's the thing that we take most of it. It's like, tell me about what you do, tell me about what you like, tell me what you can bring, and share your ideas with us. We've had students that have designed marketing posters for us because we were trying to reach an audience that we don't normally reach. And they designed it for us, and we got it out, and it really hit. And then they share it across their friends, and before you know it, I've got a whole host of teenagers sitting in the corner of the cafe, which we don't normally have. But because they're mates there, it's really beneficial. But also understanding that it's all right to be in a workplace where you're led by your heart, and also understanding that nobody in this building is a number. You're all people, you're all very important people, and it doesn't matter what you bring to work or how you bring yourself to work, you've always got something to offer. I think social enterprises are a little different in that way, and I had a little chat with some of the guys that I work with whose partners work in big organisations, and said, what's different, do you think, about social enterprises and big businesses? And one of the girls said, my partner is a quantity surveyor, and he's in a team of 50 quantity surveyors, and the boss doesn't know his name. And it's about his output, not about his outcome. And that was a really interesting thing for me to think about. Actually, it is about outcomes, and the understanding that just because you're serving a cup of coffee downstairs doesn't mean that each person that you touch, you can't make their day a little bit better. And actually the value that that brings for us as employers is really, really important, because it doesn't matter what you say to people, it's about how you make them feel that's the most important thing. And anybody can do that, and I think teaching young people that it's all right to bring that stuff and be yourself and have your little quirks and be special or be a little bit different is an amazing thing to bring, because that's going to touch somebody at some point. When my elder son, who's 16 now, when he was 14, a little bit of child labour, I might be oversharing here a little bit, but I was really keen that he understood what work was and the value of money. And I think about 2 weeks later, he's worse with money as well. He's shocking, absolutely shocking. So he needs to earn money. So at 14, I said, why don't you come down to the cafe and I'll pay you to clear the tables and to do some odd jobs and all the rest of it. And bless him, the first day, Damien downstairs, the rat bag, said, what I want you to do is go and clean all the skirting boards. Down on his knees, he didn't bat an eyelid, did not bat an eyelid. And he got down and he said, how'd you do it? Oh, my knees are really sore. So what were you doing? So I was cleaning all the skirting boards. I was like, I didn't even know you could clean. He works here now on a Saturday and has been here from its inception. But what he gets, and he's really interesting because his friends are now working at McDonald's and places where it's much better pay than we can provide. But all his friends have now lost all those jobs and they don't want to work there. They don't give a damn about you, Mum. They don't care. The atmosphere isn't nice. You're literally get in, do your shift, get your money, go home. They don't really give a stuff what you say to the customers. They don't really care. It's literally about output. He said, and I know I don't get paid quite as much. He said, but I love coming here. It's brilliant. I can sit and talk to the old ladies. You sit and helping them all out with their mobile phones and all of that kind of jazz. But that's done so much for him. And what it's done for him and a few of the others that have had work experience is realise that they can bring their authentic self. And there's some value in all of that. And he's taken that on, and the others have taken that on. Mm-hmm. So I would open my social enterprise as the best place for kids to learn about being yourself and bringing your own value. So if there's ever a way, and if anyone's ever got any, I'll have some. So that's me.
Thank you.
That's what I do.
Well, a tear to my eye, Kate, so I'm not going to say any more than that. I guess people may well have questions
or not.
Or
just full of brownies. So do you all work with students that are potentially doing work experience?
Absolutely. I'm a work experience coordinator at the college, so basically source the placements and the right matches for them, and
So we have a fair number. We have all sorts of types of students. So we have social work students, occupational therapy students, health and social care students, work experience students, because we've got so many different things happening. So we run dementia groups up here, so if they're doing health and social care, they can come and sit and work with our dementia groups, or they can work downstairs if they're doing customer relations. They can come and do that and talk to our customers and make sure they're having a good time. And I think the other thing that's been really interesting is when they first start, it's like, I can't talk to anybody. And it's like, actually, they're all older people, they
Yeah.
love a good yarn. All you've got to say is, you having a good day? And give them the little tips, and before you know it,
Yeah.
sitting down, oh, can you tell me how to get my emails off my phone? It's a joy. And seeing, because we have a lot of older people, the intergenerational stuff is really interesting and really nice, and gets people out of their comfort zone quite a lot.
Definitely.
It's nice.
Yeah, no, I'll get in touch.
Yeah, I'll have loads. I love it, it's brilliant.
That's really interesting, Kate.